Subclinical hypothyroidism or hypothyroxinemia in pregnancy. Definition. Hypothyroxinemia is subnormal thyroxine concentration in the blood. Hypothyroidism is when the thyroid doesn't make enough thyroid hormone, called thyroxine, which causes the body system to slow down. So clinical hypothyroidism is defined as a normal serum free T4 level and an elevated serum thyroidropin level. Applications in medicine. In pregnancy, human chorionic gonadotropin stimulates the thyroid, raising the free T4 level and lowering the thyroidropin level. Thus, the reference range for thyroidropin in the first trimester of pregnancy are shifted downward, as compared with values in non-pregnant women. The maternal thyroid function during early pregnancy plays a fundamental role in fetal brain development, as synthesis of thyroid hormone does not begin until the 20th week of gestation. Pros and cons. The first pro is levothyroxine treatment improved a composite pregnancy outcome in the subgroup of women who had a thyroid level of more than 2.5 mg per liter and positive antithyroperoxidase antibody. American Thyroid Association seen the early initiation of off-low dose levothyroxine therapy of subclinical hypothyroidism may be of benefit, is inexpensive, and unlikely to be harmful. A con: thyroid screening trials shown that there is not a good cognitive outcome in offspring showed a lower rate of preterm births. There is a disagreement between the two associations that supports the treatment. Gynecology recommends against the treatment, whereas the American Thyroid Association recommends consideration of treatment guided by anti-TPO positive status and thyrotropin level.
Observational studies have found associations between subclinical thyroid hypofunction during pregnancy and adverse outcomes, including pregnancy and neonatal adverse events, lower IQ scores, and impaired psychomotor development. Some guidelines recommend routine screening for subclinical thyroid disease and treatment during pregnancy, without strong data to suggest that this practice improves outcomes. Investigators conducted two randomized placebo-controlled trials at 15 U.S. centers. Women presenting for prenatal care underwent thyroid screening and enrolled in one trial if they had subclinical hypothyroidism, elevated TSH, and normal free T4 levels, and in the second trial if they had hypothyroxinemia, normal TSH, and low free T4 levels. Women in both trials were randomized to receive either levothyroxine or placebo. The mean gestational age of randomization was approximately 17 weeks in both trials. Levothyroxine doses were adjusted to achieve target TSH and free T4 levels. The primary outcome, the IQ of the children at 5 years of age, did not differ significantly in either trial between those whose mothers were assigned to levothyroxine during pregnancy and those whose mothers were assigned to placebo. There were also no differences in secondary outcomes, including cognitive, motor, language, and behavioral scores, and rates of adverse pregnancy and neonatal outcomes. The authors conclude that levothyroxine treatment, starting on average at about 17 weeks of pregnancy for women with subclinical hypothyroidism or isolated hypothyroxinemia, did not lead to improvement in children's neurodevelopmental outcomes or differences in pregnancy or neonatal outcomes. Full trial results are available at nejm.org.
We have the issue applied in Ecuador. In Ecuador, there is not a global study of subclinical hypothyroidism in pregnant, but a study in Universidad Central del Ecuador in Quito showed that 0.4% of pregnant women sampled suffered the subclinical disease. Because of that, we have an example that is from India. Conclusion. Although there is not a clear and specific treatment that corrects the brain damage that could cause the subclinical hypothyroidism or hypothyroxinemia in pregnancy, in my opinion, it will be good to apply the treatment of levothyroxine therapy and anti-TPO positive status under a therapeutic level to prevent premature births or abortions.
Symptoms. Oh man, I can tell you the tests that they do are very, very unreliable. We'll go through it and hopefully you can copy down the proper tests that can increase your rate. The standard TSH test, which registers thyroid stimulating hormone, is only about 25% accurate. We can raise it to about 50% levels if we include some of the other things.
And this is the treatment of subclinical hypothyroidism or hypothyroxinemia in pregnancy. Thank you.